What's up, guys? Welcome back to another Mobilize It video. I brought in Dr. Jeremy Pastor to talk about knee issues for weightlifters and CrossFitters, so check it out. All right, so we're back with another Mobilize It video. Jeremy, thanks for coming in.
Thank you.
All right, so we get a lot of knee issues with this CrossFit and weightlifting stuff. What sort of common issues do you deal with in your office?
So the most common thing that I actually see with people isn't just a specific injury. What it is that people hone in a little bit too much on what's actually happening at the knee rather than why. So I always tell people that the medical diagnosis doesn't really mean a whole lot to me other than just appreciating what they're coming in with. It doesn't tell me anything about how to treat them. Right, so what I want to get down to is understanding how they're moving throughout their day and also with the activity that they choose, which, you know, in this scenario is CrossFit, and understand how they're moving that's going to otherwise put the stress on their knee that they're coming in and complaining with. So whether you want to call it patellofemoral pain, whether you want to talk about meniscus tears or any type of ligament sprains, it's not going to change how I treat it unless they're coming to me after a surgery where I need to appreciate tissues needing time to heal. But if someone's just coming in with what I want to call just non-specific knee pain and they're not so married to a specific medical diagnosis, then the assessment and the treatment could look very similar for different people.
All right, so walk me through an assessment that you would need to do if someone comes in for any sort of knee pain.
Okay, so when I'm assessing someone, whether it's for hip pain, back pain, knee pain, the assessment looks the same. What we're trying to identify, again, is what is it about the activity that they're doing that's putting the stress on the joint in question. So for a knee, and I'm going to overgeneralize this to the CrossFit community, right, understanding that everyone's different, but the most common thing that we see is this kind of over-reliance on a super extended posture, partly because we need that with overhead lifts and back squats and all these exercises that we do frequently. But what happens when we get kind of biased toward this super extended posture at the pelvis is we see our pelvis kind of dump forward. This is that anterior pelvic tilt that everybody wants to talk about, right? But when we do that, right, when we use the model as like a nice visual to see, what happens is muscles on the front of the body get put in this kind of like shortened, more contract position, right? So we're looking at quads, again, overgeneralizing, and the muscles on the back side of the body get put in this lengthened position, this kind of weakened, what we call eccentrically oriented position. So when we are in this position frequently, it's a lot easier to rely on our anterior chain to kind of move our body. So what happens when we're looking at the quad, which attaches down at the patella, we're getting a lot of pull on the anterior portion of the knee, and we're not doing as good of a job of incorporating some of these muscles on the backside to just normalize forces front to back at the knee. So I would say the most common thing that I see is that whether through the warm-up or incorporating into their exercises itself, is getting the hamstrings more involved to be able to control position of our pelvis. And then if we follow the hamstring all the way down to the knee, we're also talking about being able to stabilize the posterior side of the knee and normalize those forces, right? So we're super quad dominant, we're super glute dominant, but we don't necessarily get the hamstrings involved enough.
So we want to keep everything balanced is essentially the key, and that's what causes all of that pain.
I think that's the perfect word, right? Because again, we tend to oversimplify when we describe things and we pretend like there's only one answer, but balance is the key, right? There's nothing wrong with being super dominant in our quads and being super strong. That's what we want. It's what our activities are driving us towards, but we just need to make sure that we're at least getting enough influence from the hamstrings so that we're not putting all the stress in one area. All right, so I'm going to show you basically two simple, like beginner level exercises that are going to try and address the things I just demonstrated with the model. So we're going to try and get you to be able to feel his hamstrings in a position that's actually going to influence both the pelvis and the knee. And if someone's having some non-specific knee pain, it's very possible that the pain could be completely gone right after this exercise. Not going to make that promise though. All right, so what we're going to do is we're going to have Joe lay on his back with his feet up on the box. This same exact exercise can be done with his feet flat on the wall, but the box was close, so we're going to use this. You're going to pretend like there's a softball between your knees. Sometimes I even give people a ball to use. Basically, I want your knees to stay hip width apart the entire time. So you're going to keep your knees a little bit narrower than that. Perfect, just like that. Okay? And also just be conscious that the feet aren't touching, so the feet are going to stay hip width apart too. First thing we're going to do is we're going to push our low back down to the ground, and I want you to do that using like the least amount of six-pack abs as you can. Right, just trying to get that low back flat into the ground. And the way I describe it is I want you to picture your low back and your butt Velcro to the table. And I want you to peel just your butt off the Velcro, okay? It's going to be hard for some people, even though it seems really simple, right? So that low back stays flat on the ground, the butt peels up like you're peeling it off Velcro, and what you should feel immediately is you should feel the back of your legs kick in. Now, when you know you're feeling it the right way, what you're gonna feel is you're gonna feel hamstrings, but high up towards the butt. So if you're feeling hamstrings down towards the knee, I guess I should do this so the camera can see, right? If you're feeling it down towards the knee, you need to continue to kind of get that tucking action from the hips, and you're gonna feel that sensation creep higher up towards the butt. This is how we know that we're gonna actually influence what's going on at the pelvis. We're gonna hold this position, and then I always have people control position with their breathing. Breathing's a really useful strategy to kind of kick in the right abdominal muscles at the right time. So you're gonna hold this position. I'm gonna tell you to quietly inhale through your nose, and you're gonna exhale as long as you could possibly exhale through your mouth. And as he exhales, we're gonna feel his lower rib cage come down and in towards his belly button. So give me a quiet inhale. Full long exhale. Right, and his ribs are gonna come all the way down. Keep exhaling, keep exhaling, keep exhaling. Long, 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 long. Keep going, keep going, keep going, keep going, keep going. He's gonna feel his obliques kick in at the end of the exhale, and you're gonna try and keep those engaged as you inhale again. Typically, I have people go through about a set of 5 breaths, especially if we're using this before a workout, because we don't want to take up too much of your time, right? The workout's still the show, right? So we're trying to get this going. We're trying to feel hamstrings on both sides evenly high up towards the butt, and we're trying to use our exhale to feel our obliques. Cool, so we got the first exercise out of the way. That was low level, more of like a warm up or cool down. This next one is gonna be set up the exact same way. So again, Joe's gonna be laying on the ground. Your feet are gonna be on the foam roll. Right, this is really the only way that I use a foam roll. Now you're gonna lay all the way back with your knees bent. Okay, so your feet are gonna be flat on the foam roll. Okay, so everything from a coaching standpoint is gonna be exactly the same as the first exercise. This is just gonna be a little bit more of an aggressive sensation, you know, for the hamstring specifically. So I'll use this a little bit further along in the warm up, and I use this every single time I do any type of low body workout. This helps my knees move freely. It helps my hips and my low back just kind of loosen up a little bit, even though you might get the sensation of a hamstring cramp if you do this correctly. So don't avoid the cramp, but if it does cramp, you could take a break, roll over, cry a little bit, do whatever you want, okay? So feet flat on the foam roll. Again, you're pretending like there's a softball between your knees, okay? Low back, pressing down to the ground, and get that peeling action from your butt. So slowly peel your butt up, and this time you can continue to peel the butt as high as you can get the butt by initiating it with that peeling action. So what I mean by that is I don't want you to just shoot your hips up and recruit muscles of your back. So just continue to peel up, keep going, keep going, keep going. Okay, you might not get super high like in a traditional bridge, but when you do that, right, and give us a thumbs up if you feel this, but you should be feeling a lot going on in the back of the legs, yeah? Try and go up even higher, keep going, keep going, keep going. And if you're trying this and you're not really feeling it that much, you can grab a buddy and you can have them try and roll the foam roll away from you, and don't let me win, okay? And when you try and pull the foam roll towards you with your feet, that's gonna help you kick in hamstrings even more. And again, we hold this, we'll go through a set of 5 breaths, quiet inhale through the nose, long exhale through the mouth to recruit obliques and abs and feel everything good working in there. And then after 5 breaths, you take a break, maybe do 2 or 3 sets, and then get up and move around.
All right, so now that we've gone through our warm-ups and our hamstrings are fully engaged, we're gonna break down the squat. Jeremy's gonna take us through what he wants to see and what could go wrong. All right, so let us know what's going on.
Cool, so let me preface this by saying, like, what I care about as a physical therapist is very different than what, you know, a CrossFit or performance coach should care about, right? There's no one way to squat, but if someone's coming to me with knee pain, especially knee pain with squatting, then I need to look for certain things, right? So I need that to be out there because, you know, especially in CrossFit, right, if our goal is to back squat, then taking away the back squat isn't really gonna help someone get back to what they wanna do. But, right, what we can look at is we can just look at what is your reflexive way of squatting. If I told you just stand here and show me 5 squats, I want to see how you're squatting first, and I want to identify, like, what is it about the way you're moving that could explain your pain, right? If I'm seeing anything stick out, then I'm going to try and coach you through it. So let's first just look at, like, your normal, then we'll kind of bring it through, like, a couple, like, fake deviations we see, and maybe some quick things that people could try to, like, really troubleshoot their pain and be able to work out through it. All right, so let's start with, like, show 3 or 4 just normal body weight squats, however you're comfortable. right? So like as the clinician, I'm looking at a lot of different things. I'm looking at where you're comfortable with your feet, right? I'm looking at, are you someone who's really wide base? Are you narrow? Is there any like weird movement side to side at the knees, at the hips? I'm looking at like, does your back get super arched? Does your chest collapse down? There's a lot of things we're looking at. Mainly what I care about is, do you have pain, right? Do you right now? Like,
No.
No, cool. So if you didn't, I wouldn't walk in a gym and be like, I gotta change your squat. But if you came to me, right, we'd look at certain things. So let's pretend now like you have a bar on your back, okay, right? You can see the, yeah, grab some. Great. So couple things that you're gonna see immediately, right? And sometimes it's the more advanced lifters and sometimes it's more beginning lifters, right? With the bar on your back, you're in a pretty good, strong position. But let's pretend like you just arched your back hard. So like keep your chest tall. Yeah. So the first thing you see is I'm looking at the rib cage, right? If someone's rib cage looks like it just kind of is poking straight forward, like it could poke the wall in front of us, then they lost position immediately just by loading the back, right? Because by the weight going here, everything has to get pushed forward. So with that person, the first thing I want to say is get a long exhale and feel those lower ribs come down and in towards your belly button. Just like the exercises we just did. If they can control that, cool, let's go through the squat and see how it feels. So try and keep those lower ribs controlled down towards the belly button, and now I want you to lower down into a squat. Okay, and we're just looking for any significant deviation from being able to drop that bar straight down as you squat. Okay, go through a couple more. Okay, now for the sake of demonstration, show us what it would look like if you kept your back super arched and your chest was up tall. Now just try and go, you see how the chest wants to drop even further, right? The momentum's gonna cause you to basically fold up like a book, right? So we just wanna avoid that because that's gonna put a lot of stress on the low back. It might put stress on the knee. Again, if you're coming to me for knee pain, we're looking with a little bit of tunnel vision, but we wanna be able to see the whole picture, right? So the first thing I'm saying is, can someone even control that? Now, if they couldn't, right, and they're still super arched, let's bring that bar to the front as if we're in like a front squat position. Okay, so the first thing that happens when we bring the weight to the front is everything comes back, right? It brings our center of mass back and it helps us control that shift a little bit more. So try and drop straight down, give me like 2 or 3 squats. Let's see just, you know, how it looks normally. And again, obviously you have a lot of experience with the squats, so you kind of know how to self-organize with these things to begin with, okay? What if in that position, okay, again, we couldn't control what was going on here, try and come down. Right, again, the first thing that happened is that chest falls, okay? So just because we say that a front squat helps kind of get us into a better position doesn't mean it's appropriate for everyone either, okay? What if we grab a plate? So hold this. I'm gonna take this out of the way, okay? Now I want you to reach that plate as far forward in front of you as you can. Reach, 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 as far as your shoulder blades can reach. Cool, now, you know, we're shrugging a little bit, so relax here, but reach that as far as you can and now try and drop straight down into a squat. Okay, so there's a lot of different variations that we can choose just from a setup standpoint. I'm not even coaching anything, right? I'm just saying hold this bar, hold that plate. Now hold that plate, and now what I want you to do is I want you to try and scoop your back pockets under you. Okay, like you're trying to get that tucking action that you did in the exercises you did before, okay? Now, unlock your knees a little bit, like you're bending down just a little bit, okay? And I want you to try and scoop your butt under you a little bit more. Okay, hold that position. Staying heel heavy, I want you to try and drop your butt straight down to the ground. Okay, and back up. All right, so I'll come on this side, right? I'm looking at, can we scoop our hips under us, right? Because our hamstrings attach on the back side. Can we contract our hamstrings to basically tuck our sit bones, our back pockets under us and control that as we drop down into a squat? So again, try again. And then this is what I'll coach someone through, right? I always tell my patients the day you feel a hamstring in a squat is a really good day, right? Because now we're saying that our hips are in a good position to at least get the muscle to be able to do what we want, and then we understand the muscle attaches at the hip and at the knee, okay? So if this doesn't end up being enough for someone's knee pain, then we gotta take a closer look, right? But sometimes it's as simple as just coaching or finding the right variation for someone.
Right on, man.
All right, guys, we hope you enjoyed this video about knee issues. Drop us a comment to let us know if any of these things work for you. Jeremy, thanks for coming out for this one.
Thank you.
Check out our other videos and our other content. Subscribe to our channel so you don't miss out on anything. Thanks for watching. We'll see you next time.